Welcome to the half hour to health. Okay, now we're talking about eating healthy fast. Okay, fast, healthy food. Now that's not an oxymoron. There's actually reasons for this. But the biggest thing and why you would want to eat, I think that would be more important. Now this is a cartoon. What about compulsive shopping disorder? Do you think people will buy that? Yeah, there's something to that, Tom. Understand, we're going to talk a little bit about chemical products. Okay, you might know them as medications or drugs. Now, this was a cartoon I found a few years ago. What's wild is this one on the top, social anxiety disorder, that comes from fear of public speaking. Do you realize that there's a prescription for it? This is a billable psychiatric code. I know. Fear of public speaking. It's crazy. Okay, we're making up diseases that don't need to happen. First off, the quality of your life absolutely depends on the quality of questions you're going to ask. That's not just true in health, but it's also true in science. And we're going to show you that the people that pass out medications, if there's a healthier food alternative, the questions aren't even being asked. Okay, so if you go up to a healthcare professional and they say you require this, really, doc, why do I need it? And how long should I take it for? If they say the rest of your life or your body just isn't malfunctioning. First off, what's wellness? What's health? If you ask these questions and you look for the actual answers, you're going to achieve it. Now, here, obviously the leading causes of death in this country, heart disease and cancer kills 5 out of 6 people. The materials that you're going to learn today can reverse this. Cancer is fought every day by every human being. Heart disease is fought and reversed every day by every human being. And the choices we make on what our lifestyles are. The tough part is the third leading cause of death. Now, this is according to Kaiser. The head, the CEO, said that medical mistakes kill about 400,000 people a year, ranking only behind heart disease and health. Now, you'll see a lot of these quotes. They're from the British Medical Journal. That's because European medical journals don't take drug advertisements. So we know the top 3 leading causes of death are heart disease, cancer, and medical care. Now, the reason I put this Kaiser quote up there is because they're talking about preventative medications or preventative health care. Have you heard of preventative medicine? Raise your hand if you've heard of preventative medicine. That's kind of like fresh frozen. It's an oxymoron. It's impossible. It doesn't work. Now, I'm going to tell you the myth. The myth behind this is that, first off, drugs are given to people without symptoms to change either a vital sign or blood finding, okay, such as blood pressure or cholesterol or some other type of outcome that they're hoping for. The tough part is there any science behind that? Should everybody on the planet have the exact same blood pressure? Should everybody on the planet have the same blood levels? Well, do you want to know what's weird about blood levels? Each lab is different. If you have a high blood level in Newport Beach, go to Burbank, okay? It may be normal on their scale. So blood levels or blood panels are only 15% of the diagnosis at max. The tough part is all of these medications, the statin drugs, that's for cholesterol, diuretics and beta blockers for blood pressure, vaccinations, again, that's supposed to be preventative medicine. Has any vaccination ever been tested for carcinogenesis? That means, does it cause cancer? We don't know. We do know that kids receive about 32 vaccines before the age of 18 months. So there's a lot of questions in there. I'm sorry, what was that again? Heart disease, cancer, and medical care. Okay, can you see a pattern here? But the big thing is all medications slow or stop a metabolic process, and all medications lead to some type of organ dysfunction. So we don't have a healthy food supply or safe food supply. Now, cholesterol. We just had a patient come in Monday. Now, he was with me 4 years ago. I said, sir, you really need to take care of this. He says, I can't. I'm just out here visiting my daughter. He came in Monday because at the beginning of May, he had a quadruple bypass. That means they removed veins out of both of his legs. They took the heart and they went around arteries that were clogged like this to get oxygen to extra heart muscles. Now, the science behind this, 5-year survival rates of anyone with a bypass surgery shows that if you don't get the surgery, you live longer. Okay, so it's unscientific to actually give the surgery, but the guy had insurance, so it covered it. Now, if you have a problem with a clogged artery in one area of the body, do you think you have a problem with all the arteries in the body? Yeah, you do. It's like chickenpox. Is chickenpox a skin disease, or is chickenpox a problem with the whole body? If you have a clogged artery in the heart, you have clogged arteries all over the body. So this is huge. But now, are there better solutions? What's the medical solution for cholesterol? Oh, it's a statin drug. Oh, like cholesterol drugs. Do those help? Well, here's out of the American Journal of Cardiology. They say that despite improvements in the blood lipids, that means you take a drug, your blood test comes back better. There's no change in calcific plaque. This means your arteries have no less plaque than before treatment. So that means that the drug, even though they're changing the blood test, it doesn't change the body. It doesn't change the effect. So now, what if you were told something like this? Okay, now this is again a cartoon. I'll read it for you. This drug may cause dizziness, chest pain, diarrhea, loss of memory, blood clots, joint pain, and anal leakage. Are those the side effects? No, those are the main effects. The side effect is it might lower cholesterol. Okay, now this is true. There's no way to tell how a drug will affect each person. Most drugs are only 40% effective at the time, and that's a good drug. So how will it affect each person depending on your lifestyle? We don't know. It's an unknown quotient. This is something we do know. Did you know that a cup of blueberries a day is guaranteed to lower cholesterol? Guaranteed. 100% of the time in 100% of the people. Why? Because we're designed to live on this planet. Okay, I'm sorry. I should warn you. The side effect of a cup of blueberries a day it'll help eyesight. It'll also help clean the arteries out, and also lower the risk of cancer. It increases your vitality. Should we start prescribing blueberries a day? Yes. Okay, vital. Now, this is healthy fast food. If you don't have time for breakfast, a little box of blueberries would be great. Just grab a couple of handfuls, put it in a baggie. There's your breakfast. Why? Loaded with antioxidants. Now here, soluble fibers. We talked about how arteries will clog. There's two types of fibers in the plant world. One's soluble fibers, and one's insoluble fibers. Insoluble fibers is rough plant material. What this does, this goes through and cleans out your intestines. Soluble fibers, this is amazing stuff. It actually is small enough to get into your artery system to clean out your arteries. Oh my gosh. So that means that the cholesterol drugs that don't clean out the arteries, this drug will. Now, I've got a couple of recipes on how to cook carrots fast. I'm going to describe those in a couple of minutes. But this, if you eat these every day, you're also going to, when we talked about cancer reversal, Gerson therapy does carrot and apple juice up to 20 pounds a day per person, and they have a 76% success rate in curing cancer. So is this vital with antioxidants, beta-carotenes? Okay, now here, drugs. Remember, the top 3 leading causes of death: heart disease, cancer, and medical care. All medications slow or stop a metabolic process. This is huge, huge. All medications. Does this mean Advil, Motrin, Tylenol? Yes, look at this list here. Tagamet, Pepsacid, Zantac, hay fever medications, cold medications, sleeping pills. These are all over-the-counter drugs. They can cause confusion, memory loss, disorientation, blurred vision, dry mouth, urinary problems, dizziness, shallow breathing, irregular heartbeat. Now, these are all chemical products sold to you by different companies to tell you to alleviate different conditions, different problems.